Hi everyone, my name is Michael Mackholtz, and the title of my research is Awareness is the First Step, Causes, Effects, and Steps to Prevent Students from Committing Self-Injurious Behaviors. So you may be wondering, why did I choose this topic? Well, it's a very personal reason. My sister was diagnosed with autism at the age of 2, and she frequently exhibits self-injurious behaviors, and we can actually see in this picture she has a red mark on her chin that was from self-injurious behavior. And it can be very difficult to determine what causes this, but it's very heartbreaking to see someone who's nonverbal not be able to express themselves and result to hurting themselves in order to try to get their point across that they're not feeling happy. And in the past couple months, I was named her standby guardian. So basically, when my parents are physically unable to take care of her, she becomes my sole responsibility. So I want to make sure that I have as much information as possible for when that day comes. And just to show you some examples, because you may be wondering what self-injurious behavior actually is, some of the things that my sister would do, especially when she was younger, she would punch herself in the chin and start putting pressure on her fists using her chin. She would also hit herself in the head like this, and that would obviously lead to injuries, marks on her body. And she would also lay down and start hitting her head against the floor if she was very frustrated. So definitely some very alarming events that would happen, and it's something that I want to help limit in the future. So for the purposes of the study, the main one I'd say would be to identify causes and risk factors in self-injurious behavior in order to determine prevention strategies. Because I think that is very important to know what causes it in order to figure out how we can prevent it. So another goal is to analyze the changes in behavior based on age groups and disability status. So do self-injurious behaviors get worse depending as the child ages, or if the child has a disability or not? That is something that I was really looking to find out in this research. And information to me and awareness is always essential in finding answers to questions that we may not have answers for. So hopefully the information from my research will be able to help stop my sister or maybe someone that you know from harming themselves. And to me, if we can find a way to stop one person from committing self-injury, it would be all worth it. And for my hypotheses, there were a few of them based on my research questions, which you'll be seeing in a moment. But my first hypothesis was that self-esteem issues and feelings of inferiority are the root cause of self-injurious behavior in students, especially those with disabilities, because I do believe that they know that they have disabilities for the most part, and that may cause them to have difficulties with self-esteem. My second hypothesis was that positive reinforcement and the use of a reward system would be able to help stop self-injurious behaviors if they've already started to arise. And my third hypothesis was that self-injurious behavior may become less frequent, but more intense and more dangerous as a student ages, especially those without disabilities, because that's, students reach a certain age where there might become suicidal thoughts. They may be associated with people who have had suicidal thoughts and they hear this, and that may cause the self-injury to become more severe. So for the research questions themselves, my questions were, what were the direct causes of self-injurious behavior? How can self-injurious behaviors become prevented? And how do self-injurious behaviors differ between age groups and whether or not the child has a disability? So that's what I'm trying to find in order to help maybe find an answer for, on a personal level, my sister and for anybody else who may be committing self-injurious behaviors. So my literature review included 8 articles, and most of them had multiple authors. Among the main takeaways were that approximately 28% of children with autism commit self-injury. And the original hypothesis from the researchers who tested that out said it was around 30%, so they were actually very close in their hypothesis. Causes of self-injurious behavior included association with people who also commit self-injurious behavior, so they see it from others, sexual assault, and substance abuse. Another interesting one that I found, but there wasn't a lot of information on it yet because it's relatively new, was social media, where people urge others to commit self-harm to themselves. Positive reinforcement and teaching of a substitute behavior were found to be very helpful prevention strategies, giving a child the ability to associate something else instead of their typical behavior that they would use to injure themselves was found to be very helpful. And there's also very little research that's considered sound regarding self-injurious behavior in adults with disabilities. And that's something that I found to be very alarming, which I'll be talking about in a moment. So for the methods, in my proposed study, 100 subjects would be used and separated into groups of 4. So it would be elementary school students and high school students, and those with, some will have disabilities and some will not have disabilities. There will be 25 of each group. Group 1 will be elementary school students with disabilities. Group 2 would be elementary school students without disabilities. Group 3 would be high school students with disabilities, and Group 4 would be high school students without disabilities. Each student and their parents will be interviewed, and each of the subjects would be observed during both classroom lessons and what I would call real-world activities. This could be in the hallway, this could be in lunch, basically unstructured activities that happen in school. And the interviews would cover internal causes of self-injurious behavior, so the questions would include, do you love yourself? Or the parents would maybe ask, do you feel that your child has high or low self-esteem? They might ask about past romantic relationships. They might ask about drug use and substance abuse. And observations would cover more external causes that you can see with the eye. Social interaction with their peers. Maybe someone said something that provoked them to commit self-injurious behavior. Or maybe they had a demand from a teacher and they felt overwhelmed by it, and that might cause them to commit self-injurious behavior. So during the observation, there will be a tally mark for each time a child commits the behavior, and a list as to what behaviors that the child demonstrates. So for example, if a child chins, as my sister did, as I showed you earlier, when asked to complete a task by a teacher, there will be a tally next to teacher demands and a mark of the type of behavior in order to determine a correlation between specific behaviors and the teacher, in order to determine a correlation between the type of behavior and the provoking action. And for the self-reflection, overall, there was much more information on self-injurious behavior than I ever could have expected, at least in the category regarding children. That made me very happy because it was nice to know that people have researched this in the past and that it is an issue that people care about. However, the lack of information about adults with disabilities was very eye-opening for me because, as I said before, it's a 3-year age difference. My sister just turned 19. She's an adult now, and it goes along, there's a correlation with the lack of services that adults with disabilities have, and that was something that really opened my eyes. But on a more personal note, I'm very glad that I chose this topic because I feel that the information that I gained from this helped me become a better brother, and in the future will help me become a better guardian for my younger sister. And I hope that if any of you know somebody that has committed self-injurious behaviors or does commit self-injurious behaviors, that maybe you could have learned something from this presentation. And if you ever have a question regarding self-injurious behaviors or maybe what I experienced, I'm more than happy to answer that with you and talk with you and maybe help find a way that we can help stop the behavior in your personal life. So thank you all for listening, and I look forward to viewing all of your research as well. Thank you so much.